Welcome to this session of NTV's People's Parliament, seated here at Gulu District Local Government Main Hall. We would like to express our gratitude to the leadership of Gulu Local Government and Woman MP Gulu District for the partnership with NTV People's Parliament to make this broadcast possible. Madam Speaker, Uganda's maternal mortality rates remain high as a result of lack of action addressing the physical, social, cultural, and financial obstacles to maternal health services. I propose we discuss the state of health centers in relation to maternal health.
Those in favor, aye. To the contrary, no? Aye. Ayes have it. This is NTV People's Parliament sitting here in Gulu District to discuss the state of health centers in relation to maternal health. As you are aware, honorable members, maternal health is a very important thing for the people of Uganda, and it is evident that about 16 women die every day due to pregnancy-related complications. And in Gulu here, we want to discuss the state of health centers that have been constructed by government and in relation to maternal health. But before we start this topic, I would like to ask the chairman of this district, Mr. Mapenduzi, to come on the podium and give us some little overview of the status of the district, and my counterpart, the speaker of this district, to come on this podium here to give us some small overview. Yes, the speaker, I mean the chairman of Gulu district.
Thank you, Madam Speaker. I would like to begin by giving you a warm welcome to Gulu.
Thank you.
And I want to thank you on behalf of the leadership of this district, thanking you and the entire team from NTV Uganda. First, for taking the decision to bring the People's Parliament to this district. We are a district that is currently involved in the post-conflict struggle. You very much know that our people suffered for quite a number of years. And from 2006-2007 to this day, we are working very hard with different players. I know the importance of this program is that our people are going to get involved in discussing the things that affect them. And your decision to allow them talk about maternal health, women and land, and the post-conflict recovery and development is something that will help our people participate and get involved in the discussion, but also it's a way of making people involved in developing this area.
Thank you. You have heard from the district chairman, Mr. Mapenduzi, and I want to also give 1 minute to the speaker, my counterpart. Please, can you take a podium and give us permission to use your chambers? Thank you.
Allow me to join my chairman in thanking NTV Uganda for the People's Parliament. For us, as the Council of Gulu District, we put politics on the door outside. And when we enter inside here, we deliberate on issues that affect our people.
That's very important.
And that is why you have seen the transformation that have taken place in the district.
Thank you. That is my counterpart, the speaker of this district. Thank you very much, Mr. Speaker. And we are discussing the state of health centers in relation to maternal health. We have an expert opinion here. Doctor, you are welcome to NTV People's Parliament. And please, can you give us the overview of the state of health centers in relation to maternal health?
Thank you, Madam Speaker. I'm Dr. Nick Paul, the District Health Officer, Gulu. Sometimes they call me Everlasting because we have the following infrastructures: 4 hospitals, 2 health center 2s, 17 health center 3s, 62 health center 2s, making a total of about 89. And we have the community component, that is the village health team, in 286 out of the 294 villages. The coverage is quite good. The priority areas we address on maternal and child health are the following. At the community, we have the village health team. They are charged with health education, informing the mothers about personal hygiene, their feeding when they are pregnant, and the need to immunize while pregnant, and to use clean water, and very importantly, for them to attend, to go to our facilities for antenatal cleaning. So the VHT, they record mothers present, refer them to us in the facilities. At the facilities, the health centers I've mentioned above, we provide antenatal care. Madam Speaker, government recommends 4 visits. A mother, before she delivers, should visit 4 times, so that we are able to monitor the pregnancy. We examine the mother for any complications. We screen for infections like malaria, sexual transmitted infection, including HIV/AIDS. We treat, and depending on the level, we might deliver the mother there or refer to a higher facility. The second very important area is family planning. We know total fertility in Gulu is a bit high because of the war and so on. We encourage, and this is a resolution of council, that family planning is a priority. And family planning is, for the sake of the delegates here, it is just increasing the interval between deliveries. It is not stopping pregnancy. It is increasing the interval between one delivery and the other delivery.
The doctor has mentioned to us a number of health centers. You are a doctor from Lacho Hospital. You are on the ground. Could you please tell us the status? Are these white elephants or their functioning places?
Madam Speaker, Lacho Hospital is a private, not-for-profit hospital which is under the Archdiocese of Gulu. It was founded more than 50 years ago with the mission of providing quality services to the most vulnerable. Madam Speaker, as you know, women and children, plus the destitute, are the most vulnerable. Therefore, our focus as the hospital is provide quality services to the women as number 1, followed by the children.
That is interesting.
We are therefore strongly involved in screening for female cancers. This is a weak area in Uganda, but many women are dying of cancer of the cervix, cancer of the breast, ovarian cancer, and cancer of the uterus. Many women are also dying of HIV-related diseases. I'm happy that these conditions is being handled very well with the help of partners. Treatment of obstetric fistula. We train nurses, you see some of them here.
Are the women coming to hospital for these services, most especially the pregnant women, the expecting, those who have pregnancy-related complications? Do they access these facilities in Lacho Hospital?
In Gulu district, I can testify that 70% of the mothers deliver in health facilities. But if you look at in 2007, the figure actually was about 12% delivering health facilities, and now 70%. Tremendous work in the last years. We thank the district health services for this. We therefore receive mothers, and they come. The only problem we have is sometimes there is a lot of delays at different levels.
Thank you, Doctor. I'll give you another opportunity to come back and give, because of time constraints. I want to hear from the nurses. Please, the nurses, can you tell us the truth on the ground? Do you have the facilities that you are supposed to use to help these mothers deliver well?
I'm Chit Evelyn from the Cho School of Nursing. On my observations, what I've seen, when you look at a mother that always comes from a distance, probably you find out that they come when they're really, sometimes they come when they don't have even something to carry even the baby that is being delivered. So you'll find out that we in the hospital also sometimes we provide them with other things like the linens, the gown for the babies, and so on. But sometimes you'll find out that it is due to the distance that always make these mothers here also to delay. Maybe
so these health centers are far away from the villages?
Actually, as the director has talked about, the Cho Hospital has 3 health centers. One is in Opit, whereby the Opit is really providing the services in those ones who are in those sides of Lalogi, Oyam, and so on. So you'll find out that the care that they are giving there, the mothers are coming, and really the quality of the care that is really the mothers need is really being given to them. Our main aim is now to reduce in the maternal mortality and the child mortality and the mobility rate. Thank you.
Thank you, Honorable Evelyn. Yes, Honorable, from which hospital are you coming from?
I'm coming from Gulu Regional Referral Hospital.
Gulu Regional Referral Hospital, that's the main hospital.
Yeah.
Can you please tell us the state of that hospital if you have facilities in relation to maternal health?
Okay. First of all, I'm Honorable Amono Jennifer. Actually, I'm heading the maternal head, that's maternity. I've seen there's a lot of improvement, and we are trying our best because the number of deliveries have gone up.
No more deliveries?
Yeah, no more deliveries. At least 30 per day, and that is a great number. Which means most people are now coming to the unit. But still...
Silence in the house, honorable members.
But still we have challenges, though we are working hard.
Please outline to us some of those challenges.
Now, some of these challenges, one, there is late referral, which is bringing a lot of problems in the unit. You find that a mother is left at home, laboring for long. By the time the mother is brought in the hospital, helping is already a problem. Then another challenge, we have few staff. Like, let me give in maternity. We are only 8, and out of 8, we have 3 shifts. We have day duty, evening and night. You find that only one person is supposed to do day, and there's deliveries. You are supposed to go to theater for a mother who has complication. You are supposed to give treatment. You are supposed to do everything. You are alone. No accommodation to staff. Most people request to go back at least near what? Near their homes where they can be accommodated.
Thank you, Honorable. You have had for yourself the challenges of accommodation. The challenges of staffing are very pertinent in this district. Let's go for a short break, and when we come back, we want to hear from the mothers who are accessing these facilities. Are they really good, or they are in a state of quagmire? Welcome back. You are still watching NTV People's Parliament, sitting here in Gulu District headquarters, discussing the state of health centers in relation to maternal health. You have heard for yourself, the nurses have spoken, the doctors have spoken of the state of the health centers here in relation to maternal health. And now we have mothers who are going to speak for themselves. They are the people who access these health centers. Yes, Honorable Member, you're welcome to NTV's People's Parliament. You have been to hospital, you have delivered in hospital. Can you give us what you have accessed there, what you have benefited, and maybe what you haven't?
Thank you very much, Madam Speaker, and all the members in Gulu Parliament. I'm called Betty Adong-Odong, Honorable Council from Laro Division. I deliver in Gulu Regional Referring Hospital. It is true, as our midwife said, that there are few. You can find 4, 5 of you are suffering from labor, but you find only one nurse. He had to go to test you, he had to go to deliver, while others also. If you have somebody, your attendant, you have to be near you. If you are almost to deliver, she has to run and call for the same midwife. Now we are requesting that if you can hire midwife other than nothing.
Thank you so much. You have heard she want more staff, she want more midwives in hospitals. Yes, Honorable Member, what is your opinion on this?
For me, I've delivered in Lacho Hospital twice. I would like to confirm that it is true their services are okay and they have equipment. I deliver through cesarean sections, only 2 deliveries. But what I would like to say that they are really overwhelmed with number of patients in the hospital. I remember in my first delivery, I was not so much helped in time. I remember I went in the hospital already in labor on Saturday, but I was taken for cesarean on Monday. It was not something good.
What caused that? What caused that?
The doctor on duty was being called, but it's like he was not responding. I don't know what was wrong. Then, in the second delivery, I was helped very well, and even I found the services improved. After coming back with the babies, even the attendants were not taking care of the baby. The nurses were there bathing the baby, even the mothers, they were being cared for. So I appreciated it so much. But what I would like to say is that there is need for increase of personnel because the time you take to get the services is too long. When you go for antenatal care, you can even take the whole day. You know when you are pregnant, you are expectant. It is really tiresome to sit for the whole day in that state.
Thank you, Honorable Member. Can I have the district health officer to come and give us why are the doctors not on at the workstation? Yes, Honorable Member, you're welcome to NTV People's Parliament. Do we have, which hospital are you coming from?
Gulu Regional Referral Hospital.
Wonderful. Do we have finances to ensure that you do your work effectively?
The finances are very limited. That's why we lack many things, including human personnel. Antenatal care, deliveries, gynecological surgeries are all going up. Abortion is going up very highly also. And then we have, let me give the statistics of abortion is in 1,774. That is 2012-13.
That's alarming.
Very alarming. That's OPD care plus inpatient care. And we have 891 for last financial year. This first half of the financial year is up to 470. And yet, the big challenge we have in reproductive health, we have almost, I will say, no, apart from me, there is no other specialist in Gulu Regional Referral. No other senior consultant, no consultant, no special grade medical officer, that's those who have just finished their specialty course. And no full-time medical officer. We share one medical officer with the HIV clinic. Delivery beds are very few, to the extent that even two substandard theater beds had to be put in delivery room. It's not enough. Substandard.
For emergencies.
Yeah, because for theater, we need quality bed that cannot be sucked in by blood. And as they said, there are also this lack of star plus these beds. There are 5 delivery beds squeezed in a space of 4 deliveries, but they are overwhelmed. Sometimes we have deliveries on the floor because of the number. And indeed, we have only 36% of the staffing for Gulu staffing norm. Gulu Regional Referral, only 36.
Thank you, Honorable Member. Can I have one father who are delaying the mothers at home, the pregnant mothers? Can I have one father come on the podium? Yes, doctor. The doctors are not at the workstation. If it was not God's mercy, that lady who was operated on would have died.
Madam Speaker, let me take this occasion to thank the previous speaker for choosing Lacho Hospital for our delivery 2 times. That shows that she has confidence in that hospital. If it was true that the first time she was with Endlo, do you think she would have gone back for the second time?
But she delayed. There was a delay in going to the theater because the doctor wasn't picking his phones.
Madam Speaker, let me tell her that the first cesarean section should not be done in a hurry. You should be given time, and we are the experts.
Order, honorable members.
I presume the first delivery was at least 3 years ago. At that time, Lacho had 3 specialists. We have lost 1 to Sudan now. But the critical cadres for deliveries are the midwives. Do not underrate the midwives. Without midwives in this country, we shall not fight the high maternal mortality. She was handled by the midwife.
Thank you, doctor, though you have not clearly told us why these people are not picking their phones. What happens? Why isn't a doctor at the station? Are you few?
What I heard from the previous speaker was that the doctor was being called. I don't know how, whether by phone or by any other means. But I know that she was under good care of the midwives.
Okay, thank you.
That is, I presume both your babies are alive and well. And you will come for the 3rd time.
Thank you. Yes, the nurses have said there are delays at home. What causes the delays? You are a father and you should have had a pregnant wife at home.
Thank you, Madam Speaker.
Yes.
I'm the father, and not only the father, I'm honorable member of the People's Parliament, represent the people of Peche Division.
You are welcome.
It's really true, in Gulu Regional Referral Hospital, there is problem in concerning the maternal health, because one of the reasons, if you go there, you will find that the necessary equipments to handle complicated deliveries are not there.
What are those equipments?
We don't have ultrasound machine. They may be sharing one ultrasound machine for the whole hospital. And really, you know, maternal health is something emergency. So that is one of the problems. The human resource, as have been said, the consultants are not there to do really cesarean section as required. Myself, I deliver only firstborn in Gulu Hospital, and the next child.
Order, honorable members, order. Yes, go ahead.
The other children, I had to do proper family planning and see that I have to take them to Lacho Hospital.
So Lacho Hospital has better facilities than the Gulu Referral Hospital?
Better facilities. Okay. The first one was delivered in Gulu Hospital because it was emergency. It came at night and transport was not available to take up to Lacho. Then I decided to take to Gulu Regional Referral Hospital. Yeah. We need to improve the services at the Regional Referral Hospital because this is next to National Referral Hospital. Okay. Without equipment and human resource and proper financing, the hospital cannot run. There is no fuel for generators sometimes. You find that the whole hospital is in a total darkness.
Are there ambulances in the district?
Ambulance, we have only one in the Regional Referral Hospital that is fully operational. And the size of the northern Uganda, a solely sub-region, being served by only one hospital, one ambulance cannot serve the population.
Thank you, thank you. Just because of time, in 2 minutes, what do you have to say, Father?
Yes, my name is Komakeche Enriquilama, and I'm a very recent father, like less than 2 months old. Yes, my son was delivered on 29th of October last year. So I'd like to put on record that actually the 3 of my children were delivered at the Cho Hospital. I think it's about choice as well, because I think in terms of facilities, the Cho is fairly equipped as opposed to Gulu Regional Hospital.
What about the other small health centers, Health Center 3, Health Center 2?
Unfortunately, I think we need to work on our referral system so that at least the regional hospital is the last resort. Right now, everyone runs to the regional referral hospital, and yet should have been the last point of contact after the health units have failed to deliver. And that's a challenge. So we must really give assurances, perhaps, in terms of having the lower units more equipped to handle some cases, then the referral should be by way of a last resort, if it were possible.
Thank you, Honorable Member. Let's go for a short break, and when we come back, we want to hear more from the mothers and maybe from down these small health centers. Why are the mothers leaving the small health centers and going to the regional hospital? What are the facilities that are lacking in those hospitals? Welcome back. You are still watching NTV People's Parliament, sitting here in Gulu district. The hall is full to capacity and people are eager to voice out issues that affect their everyday life. We are still discussing the state of health centers in relation to maternal health, and you have heard for yourself very many challenges here in Gulu and northern Uganda in general. Yes, the mothers want to speak for themselves. Just in 2 minutes, Honorable Member, what do you think should be done to enable you have a health mother, a health child, and you also go home when you are alive?
Madam Speaker, my name is Harriet Aloyo Nyeko. I represent the mothers in the community that we work with as World Vision. We do not have many of the mothers here, but Madam Speaker, the conditions of the health facility 2 and 3 are alarming, and it's the very reason you see overwhelming number of mothers come to the regional referral hospital and to Lacho Hospital. Madam Speaker, the director of Lacho Hospital talked about Lacho Hospital having overwhelming number because it's the best, but sometimes the reason people go to those hospitals because they do not have any other option, and that is the only options they have. The mothers who deliver in health center 2 and 3 do not have the options of financial capability to travel to this hospital, and because it's the only options they have, and so they get services from those hospitals. It is my prayer, because of the conditions they are in, that let us focus at improving the health facilities where the majority of the mother deliver from, in order for us to be able to improve health services and maternal health, not only in this hospital where people can afford, but also where people can access. Because when you're talking of access, some of the accessibility require money. And not all mothers can come to Lacho Hospital, not all mothers can travel to Gulu Referral Hospital, and so we need to improve service delivery in all the facilities. Thank you,
Honorable Member. I think you have heard for yourself. Let us improve the facilities that are on the ground. The health center 2s, the health center 3s, such that these mothers can get services down there instead of trekking long distances to the regional hospital. Yes, Honorable Member.
Talking from an experienced point of view of the health centers, these health centers lack really all the facilities, if I may say, to serve the mothers who are delivering. That is the reason as to why most mothers tend to hurry and come to the referral hospitals or Lacho Hospital. From an experienced point of view, a referral was made to my own sister from Olwal Health Center, which was referred to the regional referral hospital. Reaching here, there was no ambulance, there was no person to attend to the person.
So you need more ambulances in
Exactly,
the region.
we need more health workers, we need those people so that they can attend to us. Because in such a situation, the lady ended up losing the baby, which was a very painful situation, and it was really bad. No even facilities and equipment were even in place. We had to again spend more money and go elsewhere for a simple thing like scanning to find out the state of the pregnancy. And really, the referral hospitals have to really be well equipped and at the grassroots levels.
Thank you, Honorable Member. Yes, in terms of policy issues, what can be done?
Yeah. Thank you very much, Madam Speaker. I am called Honorable Andrew Ogweta Oto. The decentralization policy that we have in this country does not favor a district to decide on its own. It depends a lot on national programs that come into the district. And I will talk this in light to human rights. The right to health is not properly enshrined in the Constitution of the Republic of Uganda to give us citizens the right to hold government accountable towards giving us this right back. So all we have is the right to a clean and healthy environment. If we had the right to health, it would be government responsible for referring any person out of the country for better health services. But you will see a mother advertising on newspapers, asking for funds that whoever can help me. Government can no longer, and this is a taxpayer.
Thank you, Honorable Member, for that policy issues. Yes, Honorable Member, just in 1.5 minutes, please, can you wind up on the suggestion is what can be done?
Madam Speaker, I want to say that the problem that we have in our place here is basically the administration unit. It is too big. You can find a sub-county is even equivalent to a district in the south there. So you cannot say that a person who is, a health center too, can serve the entire population of that place. Meaning that our leaders who are in parliament, of course, in the council here, we have already passed a law that we should divide the parishes, we should divide the district, and we should even divide the county. But you find it is a silent thing from the ministry up there.
The problem at the lower facilities, there are very few staff. For example, in a health center too, where we get 24% of the mothers delivering, there is only one midwife. Two, equipment, commodities are not provided at that level. But now, of late, we have provided mama kits. This is an intervention by our partners.
Do you receive mama kits, you women of Gulu? There is a yes and no. Go ahead.
There's no. You know, here I'm talking about the mother who is there in the village. They are getting the mama kit. But if these women are in town, probably they don't get. But definitely, we have the records. So I wanted to set that record straight, that the lower facilities are also performing their duties of delivering mothers. But then the mothers in the municipality have the choice of going to Lacho or Gulu Hospital. And the number is equal as far as my statistics is concerned. Thank you.
Thank you, doctor. Yes, the mother is very eager to say something. Please, in 1.5 minutes, can you please... Can I have a microphone over to that mother raising up hands? She wants to give, just in 1 minute, Mamu, give your information. Please, I have not given you an opportunity.
I thank Lacho Hospital very much because we have never had any serious deaths after birth, which is taken to the police. Because twice there was death in the hospital here because of mishandling, and it was taken before the police. I have understood now that the nurses are few, but also the nurses should handle. You know how you handle a patient? Somebody who has come. I'm telling you, Gulu Hospital doesn't handle patients very well.
So the nurses in Gulu Hospital are not disciplined?
So the nurses and whoever the authorities would stand to see that the patients are really...
Can I have a nurse from Gulu Hospital, please? You're not handling the patients well.
As she had already said, it has happened once that somebody was taken. But it was because she was alone. Mothers were delivering. And this lady went and delivered in the corridor. So she overbled. By the time she came, she died. And the case is still in court.
Are you handling mothers well apart from that case?
We are handling mothers well. Now, if we are not handling well, why do they come so many?
If there is only one midwife in a facility which is provided for by government, this midwife has a right also to get pregnant and to go on leave. So we should increase the number of midwives in our facilities.
Thank you. Thank you, Honorable Member. What is your way forward as we wind up the debate?
I deliver in Gulu Referral Hospital, backs here. Those days, nurses were in a good age. Those midwives, they are not young people. They were mothers. They know how to handle mothers. But now we are having students who hasn't delivered even one. Those nurses in referral hospital, they are very stressed because they are coming from outside. They are being blocked outside the gate. They are moving from far coming to the hospital. Even one time you'll find a gatekeeper going to deliver a mother in the hospital because there's no nurses in the health center, Madam Speaker. We are requesting the government to give more manpower in the hospital. Thank you, Madam.
Thank you. Yes, Afande.
I'm Honorable Patrick Jimmy Okema. I represent the police in Aswa region. Madam Speaker, aware that what the honorable members are talking about, something which has been left out is element of ethics and integrity and professionalism. It is very true, Madam Speaker, that as the police, we have received some cases as pertain issues of negligence. One of the members talked about that. It is very true. As I speak now, there is a case which is still being battled in court over issues of negligence where a mother was taken to the hospital, but unfortunately, because of that element of negligence, it is true that both the mother and the child, they died. So I want to emphasize that people must know that the law is there, and sometimes it is true, people speak about this, and they do not come with evidence, and they do not come with it to police. It is very true that for a case to stand in court, it is important we provide all the necessary evidence so that such a person, it is handled by the court of law according to the Republic of Uganda. Thank you very much, Madam Speaker.
Thank you so much. Can I have you, the last speaker, please come and take up the podium? I'm giving you just 1 minute to wind up because you are a mother.
Thank you, Madam Speaker. I'm called Rose Samona Billy. I represent the people of Buatira in Gulu District Local Government. At the same time, I'm the Secretary for Health, Gulu District.
Go ahead.
I feel like I should give this information according to the reactions being given in by the honorable members of this parliament that some issues concerning the health center 2, 3 were not very true. Some were true because I've been monitoring. Respect for my views, please. I've been monitoring these health facilities. I think I would like to agree with the doctor, the DHO, that we have few staffs which is making really our services to these health centers not very perfect. And I would like to agree with the concern raised by other people that we have to accept and say to the government of Uganda that we need to give in more staffs to all these health facilities so that we see. And another information I want to say, Gulu district tried very much to get at least a motorcycle ambulance which was sent to some of the sub-counties in the district, and we are still even expecting more so that we increase and we see how we could really help these mothers to access the services they want at these health facilities.
Thank you, Honorable Member. Can I have the district woman MP to give us 2 minutes some resolutions?
You know that issue of maternal health, maternal and child health is very passionate to especially us women, even in parliament. When we decided that budget for health was to be added, it was about maternal health. And we went as far as saying, Ministry of Health should not just give budget lump sum like that, but they should specifically say this one goes to maternal health. Because giving life, bringing life to the world should not make a woman die. But a lot of our women die because of that. So Uganda Women Parliamentary Association takes issue of maternal health as very passionate. The truth is that we still have a lot of challenges, and we must not run away from airing that out so that we continue to improve on them. Those of us who move out into the community get a lot, and they are helping us because as a politician, if I say it out, then they say that one is saying politics. Yes, it is not politics. We want people to speak the truth so that we are also able to add more. And in case of policies, when they talked about parishes being too big, because by policy, all the parishes are supposed to have health center too. And we also insisted that health center too should have some provision for maternal health. Ordinarily, health center too does not have provision for maternal or for maternity wing. But we say let maternity wing be there. And probably even then the village health team, we should have some budget for the village health team so that they follow mothers and encourage mothers to go and really deliver in the word. I have a lot to offer in this, but we are very grateful to hear from you as a mother and as a member of parliament who also subscribed to Uganda Women Parliamentary Association.
Thank you, Honorable Member.
Continue to see that.
Now, can you please 1 minute wind up? What are the resolutions? What is your resolution as a young mother?
Thank you so much. I'm Lucky Gender Fancy from Gulu, representing FIDA Uganda. I have 3 issues. I'm going to be very brief.
In 1 minute?
Yeah, in 1 minute. First, I cannot go without telling you that health centers are very far. Our mothers are dying even before reaching the health centers that they were provided for. Then secondly, you've praised the hospital very much. They even came here and said they are screening cancer for women, treating fistula.
Which is a good thing.
Yeah, very good, but at what cost? It is very expensive, and yet our mothers in the villages are very poor. Then my third point is, we have brought in solutions.
Like your hospital, you are very expensive. Let one microphone, please.
Madam Speaker,
minute.
I think we have agreed to speak the truth in this house. Fistula care in Lacho Hospital is completely free. Mothers delivering in Lacho Hospital pay 5,000 shillings. For cesarean section, they pay 10,000 shillings. Is that very expensive, madam?
Thank you, thank you. Can you wind up with your last point, please?
Thank you. That was my second point. He talked of fistula. How about screening cancer? How much do they pay for? Then he talked of training nurses. How much does people pay? Then my last point. People have been providing solutions that government has to stock hospitals, bring workers, but we have not talked of where the finances are coming from. The size of parliament is very big. Our MPs, when they are discussing about giving them iPads, the size of parliament is very big.
No, can we discuss maternal health, please?
When they are discussing about maternal health, the size of parliament is very small.
Okay, thank you, honorable member. You have heard for yourself. The women of Gulu district and northern Uganda have spoken. The fathers have spoken, the nurses and the doctors have spoken. The powers that be should hear and address the issues that affect northern Uganda. Because of time constraints, we cannot continue with this program, and I'm still Agnes Nandutu, the Speaker of People's Parliament. I adjourn this house until next week.